May problema ka ba tungkol sa varicose veins? Gusto mo bang malaman kung ano ang dahilan at bakit tayo nagkakaroon nito? Hi gorgeous viewers! I'm Wilhelmina Manikis. Just call me Doc Mina. I am board certified in dermatology and cosmetic surgery. Welcome to my channel. My topics will range from dermatology, cosmetic surgery, aesthetics, skincare, and wellness. If you find value in my blog, please like, share, subscribe, and ring notification bell for any future blogs. So, let's get started. First and foremost, what are veins? Veins are blood vessels that return unoxygenated blood to the heart from the different parts of the body. By unoxygenated blood, we mean there is no oxygen and no nutrients present, but instead, the blood is full of waste products, including carbon dioxide. Arteries, on the other hand, are blood vessels that bring oxygenated blood from the heart to the different parts of the body. So, arterial blood means red oxygen-rich blood, while venous blood means blue oxygen-poor blood. Sa Tagalog, ano ba ang mga ugat? Mayroon tayong dalawang uri ng ugat, veins and arteries. Ang veins ay daluyan ng dugo pabalik sa puso. Ang arteries ay daluyan ng dugo mula sa puso. Ang dugo na dumadaloy sa veins ay wala ng oxygen at sustansya mula sa iba't ibang bahagi ng katawan. Sa arteries naman ay dumadaloy ang dugo na may oxygen at sustansya para mag-supply sa iba't ibang bahagi ng katawan. Tandaan, veins, walang oxygen at sustansya. Arteries, may oxygen at sustansya. Just to give you additional information para mas maintindihan mo or to better understand the veins, what are the functions of the heart and lungs? The function of the heart and lungs are linked together, working as a team to oxygenate the cells and tissues of the body. The heart is the pump which moves the blood. The arteries and veins are the pipes through which blood flows. The lungs provide a place to put oxygen into the blood in exchange for carbon dioxide. Every time we breathe in, we are infusing blood, flowing through tiny vessels in the lungs with oxygen. When we exhale, we bring out carbon dioxide. Ang gawain ng puso at baga ay magkaduktong at nagtatrabaho bilang isang team o pangkat para magkaroon ng oxygen sa iba't ibang bahagi ng katawan. Ang puso ang motor pump, ang mga ugat, veins and arteries ang daluyan ng dugo. Ang baga ay siyang bahagi kung saan pumapasok ang oxygen kapalit ng carbon dioxide na inilalabas din galing sa baga. Tuwing tayo ay humihinga at lumalanghap ng hangin ay may oxygen na pumapasok. Sa kabilang dako naman kapag bumubuga o inilalabas ang hangin ay kasamang inilalabas naman ang carbon dioxide. This oxygen-rich blood circulates throughout the body to nourish the cells and keep the body alive. When oxygen is depleted, what is a healthy vein? A healthy vein has a one-way valve or one-way door that ensures blood coming from different parts of the body to travel in a forward direction back to the heart for oxygenation purposes. This one-way valve will prevent backflow of the blood. So, ang malusog o normal na vein ay may one-way valvula para umakyat papunta sa puso sa isang pataas na direksyon galing sa binti pabalik sa puso. Ang valvula ay pipigil sa pagbagsak ng dugo sa halip na paakyat pabalik sa puso. What is unhealthy vein? There are many factors which I will discuss later that may weaken the walls of the veins. This weakening of the wall will consequently lead to weakening of the valves also. Eventually, these valves will be damaged. This is especially true in the legs due to the force of gravity. Ito ay karaniwang nangyayari sa binti dahil sa mas malakas na puwersa ng gravity pababa kaysa pataas papunta sa puso. There will be swelling o pamamaga dahil sa pag-iipon ng dugo or due to the collecting or pooling of blood. This will cause sluggish circulation with stretching of the vein walls leading to increased pressure, causing the veins to enlarge and appear in the surface of the skin. This is further aggravated by prolonged sitting and standing with more pooling of blood in the leg vein. So, ang posisyon na palaging nakaupo o nakatayo ay lalong makakadagdag sa pag-iipon ng dugo sa binti at lalong pagbagal ng daloy ng dugo. Depending on the severity, varicose veins are twisted, enlarged, dilated, and overfilled with blood. They usually present as dark purple or blue in color. They are located near the skin, thus they are superficially located. Please note that any vein may be varicosed. Ang kahit na anong ugat ay pwedeng maging varicose vein. However, due to gravity and the amount of blood that can pool in the legs present the biggest risk. So, varicosity is most common along the legs due to the increase in pressure in the veins of the lower body. The heart is the primary pump and the leg muscles are the secondary pump of the human body. What is a thrombus? A thrombus is a blood clot that forms inside a blood vessel. Ito ay namuong dugo sa daluyan ng dugo. If a thrombus breaks free and travels through the bloodstream, it is now an embolus. Kapag ang namuong dugo ay humiwalay sa ugat at sumama sa daluyan ng dugo hanggang makarating sa isang maliit na ugat na pipigilan ng pagdaan ng dugo, ito ay embolus. Embolus is anything that moves through blood vessel until it reaches a vessel that is too small or too tight to let it pass, impeding blood flow. So, pwede itong namuong dugo, pwedeng air bubbles, pwedeng fatty deposit, or any object carried in the bloodstream and cause embolism. Thrombus can form which pose a risk for separation and migration to the heart as emboli, which may also propel to the lungs, carried in the bloodstream, and cause embolism, along with the unoxygenated blood that carries them. By embolism, we mean resulting in obstruction in the ventilation or breathing process of the lungs, from dyspnea to death. By dyspnea, we mean difficulty of breathing o hirap sa paghinga dahil sa baradong daluyan ng dugo. Varicose veins may not be a serious problem at first, but may progress to some complications like ulcers, bleeding, and skin discoloration, depending on the severity. What are the risk factors in increasing pressure in these leg veins? Overweight, obesity, in older age group, because valves deteriorate with age due to wear and tear. It is more in females, more for inactive people, more for those people with leg injury, those who are pregnant and are smokers, those taking oral contraceptive or hormone replacement. How is varicose vein diagnosed? The diagnosis will be based on complete medical history and complete physical examination. If needed, a duplex ultrasound may be requested by the doctor. What is a duplex ultrasound? It is a vascular ultrasound to check blood flow and structure of leg veins. What do you see in this ultrasound? Actually, it is the simplest, most cost-effective, and easiest to perform for vein visualization. Using a transducer to search for blood clots in the legs. If patient complains of pain or swelling, the doctor may request for the ultrasound to check if symptoms are caused by the blockage. It takes about 30 to 45 minutes to complete this ultrasound. We must take into consideration the risk factors to prevent it. Maintain a healthy diet and exercise to keep weight under control and keep the heart in a good condition. A good strong heart keeps blood pumping and prevents buildup of pressure in the lower extremities. Keep off extra weight to reduce unnecessary varicose veins. Treatment is for cosmetic reason, especially if it's very noticeable already due to the unsightly cord-like appearance, which may be embarrassing to the patient, making her feel uncomfortable. Treatment is to alleviate related symptoms like aching, swelling, burning, and night cramps. One of the most commonly used and safest treatment before resorting to other surgical approach, especially true for spider and reticular veins, is sclerotherapy. It is a non-surgical form of treatment which is done in the doctor's office without anesthesia. It is an in and out procedure, more or less 1 to 2 hours with no significant downtime. So that is it, mga kaderma at mga kabalat. I am just giving you a bird's eye view of the treatment that can be done and is available for this varicose vein problem. Please watch out for another blog discussing types of varicose veins and treatment that can be done like sclerotherapy. If you find this topic helpful, please like, share, subscribe, and ring notification bell so you don't miss out on future vlogs on more skincare and wellness tips. Bye for now. See you around. Let us all keep safe. Take care, everyone. Mwah.